Imagine a 16% chance of dying every time you had a dentist appointment. And those are the best odds you could hope for. That was pretty much surgery in the 1700s to 1800s, before anesthetics was a thing. Barber surgeons were then the most qualified to perform these procedures, due to their precision and speed in wielding sharp blades. And speed was key, because without any sort of pain relief, a patient's survival relied on how long the surgery dragged on. Some of the best barber surgeons were reportedly able to amputate a leg in 25 seconds flat. Even when sedation was used, doctors resorted to crude methods, like making their patients drink a crazy concoction of bile, vinegar, and opium to knock them out, or sometimes knock them dead. Then there was compression. This involved putting pressure on nerves and carotid arteries to make a person unconscious. Basically, a medically nicer way of saying choking someone out. Another mainstream sedation technique at the time was mesmerism, where doctors hypnotized patients by using intense eye contact and rhythmic hand movements in order to manipulate the body's magnetic fluids. At its peak, London had full-on mesmerism hospitals. Mesmeric surgery demonstrations drew huge crowds, and even leading medical journals like The Lancet endorsed its use. But thankfully, Robert Liston, one of Europe's top surgeons, the guy with the 25-second amputation record, and the then stellar 16% surgery death rate, helped to ban the practice. This made room for the eventual rise of inhalable gases like ether and chloroform, which became the precursor to our modern anesthetics. So if you had to pick one, which of these Victorian-era sedatives would you go with? Because can you